Increasingly worldwide, plant health clinics, or PHC, are seen as a way to address issues on pests and diseases, soil health, or bad weather. Since the concept was first trialed in South America in early 2000s. Since then, plant health clinics found favor in Africa, Asia, and from 2012 into the Pacific.
The trainings involve mostly extension officers, and there's this group of this regional team that conducts the plant health clinic trainings, and the aim is to help extension officers to become plant doctors.
Plant health clinics were implemented in Solomon Islands in 2012, Fiji in 2015, Samoa in 2016, Tonga in 2018, and most recently into Papua New Guinea and Vanuatu in 2022. More than 80% of the population in Papua New Guinea engage in agriculture for their livelihoods.
The plant health clinic concept came about when there was a need seen in the farmers' access to information on pest and disease, and that would make it more accessible to the farmers. We get selected extension officers. They become plant health doctors, and through them, they get the information filtered down to the farmers. So they get their information from researchers, who allows them to get the training under plant health clinic trainings.
The first plant health clinic training in Papua New Guinea was held at the University of Goroka, Eastern Highlands Province. The Department of Agriculture and Livestock Extension officers, lead farmers, and students from the Division of Agriculture and Rural Development were trained as plant doctors.
Plant health clinic is so important because during our extension services in rural areas or in the districts, we only emphasize on people to grow food crops to sustain their livelihood. But in terms of pests and disease, we don't talk much. But the training that now we acquire that enhance our skills and knowledge to go out and at least we can talk to them to understand the food crop pest and disease. By the time you spray, you must spray on top, volume on plastic, you turn in spray raw. Underneath you.
So this is something new, and to me it's like very important, especially like us agriculture students. When we go back to our village, many people will come and ask us, oh, so you are agriculture students, or what is this, what is that? They will ask. So I think plant health clinic has taught us very well and taught us a lot, especially in identifying pests and diseases and how to diagnose the plant.
Training lead farmers to work closely with agricultural extension, educational institutions, and researchers. The lead farmers will be community-based facilitators for a wide reach in rural communities with plant protection services.
When I'm training, mi kam kisin lo iya time mi plak kambum na heavy meeting now and ba mi serim one time all mama lo. How to look out in more plants, ploy.
Plant health clinics actually usually run in a community-based area or in a marketplace. Plant health clinic operates more like a medical clinic, where the plant health doctors set up a station, and farmers can get the samples and have access to the plant health clinic setup, and have their questions raised, and their answers can be given through the plant health doctors to the farmers.
Na smell goya and binatang is like you. Siyempre ron come to him sa come time you planning a fest and come up there. And taro lang putin kay Gabriel now binatang is.
Well, after this training, I have organized with my women groups, and we will be gathering for a big meeting, talked about what I have learned from plant health clinic. And then when they go back to their own farming system in the village, they will exactly know what they will know how to control over the pest.
The plant health clinic's relevance to Papua New Guinea is that it brings farmers knowledge to areas where they are not too familiar with the pest and disease issues, and plant health clinic provides an avenue to bring that knowledge, bridge that knowledge gap.
Our government's focus now is on agriculture. So plant health clinic is very important aspect of that policy. So we must put our hands together and address this aspect of plant disease management through this training.
The plant health clinic allows farmers have access to information, to also have a platform where you can use technology to access those informations for the farmers' benefit.
We have an application that was built in line with the manual that you have. If you have a manual, turn to page 125. And I'll show you the application. It's just easy. It's just a 5 kina flags. You just get the data. It's about 46 MB. And you download this application called Pacific Pest.
From me, very significant message I got from the throughout this 3 days workshop is that it makes it very simple for the farmers to use the modern technology like phones to access everything inside, like how you can diagnose the plant problems.
Plant health clinics will be incorporated into the agriculture and rural development curriculum in the University of Gurkha for students taking agricultural extension and agricultural education. Agricultural extension students can opt to do plant health clinics as the industrial training, and students completing studies in agriculture education can run clinics at the schools.